Acute heart failure causes and symptoms. Acute heart failure refers to the heart being unable to pump enough blood around the body. It occurs suddenly and can be life-threatening. If a person has heart failure, their heart cannot work effectively to supply blood to the body. This may be because it cannot relax as usual. Heart failure can cause fluid to build up in the lungs. A person may notice breathlessness, changes in their heart's rhythm, and fluid retention, which can lead to swelling in their legs and elsewhere. The symptoms of acute heart failure either appear suddenly or worsen quickly. The underlying cause may be damage or stiffness in the heart, and the stiffness may have developed over a long period. Anyone with symptoms of heart failure needs immediate medical attention. The doctor may recommend taking medication, making certain lifestyle changes, or having surgery. This video explores acute heart failure in detail, including its causes and symptoms. Types of heart failure. Heart failure means that the heart is unable to serve the body's needs because it cannot pump enough blood or relax sufficiently. Acute heart failure can result from an event such as a viral infection or blockage affecting an artery around the heart. Doctors may call this de novo acute heart failure. It may instead result from damage in the heart, which may have developed over time. Doctors may call this acute or chronic heart failure. Heart failure can affect one or both sides of the heart. However, it usually starts on the left side. Left-sided heart failure can be diastolic or systolic. Systolic heart failure affects the left ventricle and the way it pumps out blood. Diastolic heart failure happens when the left ventricle does not relax properly. Right-sided heart failure can happen alone, but it often occurs with left-sided heart failure when the left chamber puts pressure on the right side. Congestive heart failure develops when blood flow from the heart becomes slower, causing a backup of blood returning to the heart. Fluid collects in the legs, abdomen, lungs, and other parts of the body. If it collects in the lungs, the medical name for this is pulmonary edema. This type of heart failure can also be diastolic or systolic. Symptoms. Acute heart failure can cause a buildup of fluid in the lungs and cardiogenic shock, which refers to the heart being unable to pump enough blood to the brain and other key organs. This can lead to confusion, rapid breathing, a loss of consciousness. Multi-organ failure. People with acute heart failure may also have breathlessness, especially when walking. Swelling in the lower limbs or abdomen. Shortness of breath when lying down. A need for extra pillows. Weight gain. Low blood pressure. Progressive fatigue. A cough. Causes. The heart has 4 chambers which work together to pump blood around the body. Problems can arise in any part of the heart. In cases of de novo acute heart failure, a single problem or event causes symptoms. This may be a virus, drug use, sudden damage to a heart valve, or a blockage in a coronary artery. In cases of acute or chronic heart failure, the heart tries to compensate for a loss of squeezing or relaxing function that has developed over time. Here are some of the ways that the heart tries to compensate. It stretches so that it can contract more, eventually becoming enlarged. It develops increased muscle mass, which can stiffen the heart muscle. It beats faster as it tries to supply more blood. Blood vessels narrow to maintain blood pressure. The body diverts blood away from other organs toward the heart. In time, these changes can affect the health of the heart and other organs, such as the kidneys. A problem with the kidneys can also worsen fluid retention from heart failure, as the body is unable to get rid of salt and water effectively. Lifestyle options. As part of a person's rehabilitation plan, the doctor may recommend losing weight if appropriate, having a healthy diet that is low in salt, fat, and sugar, and high in fresh fruits and vegetables, getting regular exercise, managing stress through exercise, meditation, and rest, avoiding smoke or quitting smoking if necessary, attending regular follow-up visits and taking medications, limiting the intake of sodium to fewer than 1500 milligrams per day, limiting the intake of fluid to under 2 liters per day. Be sure to check with a doctor before making this or any other lifestyle changes.